Assalamualaikum warahmatullahi wabarakatuh. Uh, Hello, my name is Achmad Irfan and I'm student of University of Darussalam Gontor. I have majority our program in international relations. Okay, here today I am gonna present to you all about the COVID-19 and its handling in Europe. Here gonna I present. So stay tuned in my presentation. Okay. Before we going through to the Europe COVID-19 case or issue, you must know about the COVID-19 itself. COVID-19 is uh, is an infectious disease caused by a newly discovered coronavirus. Most people infected with the COVID-19 virus will experience mild to moderate respiratory illness and recover without the need for special treatment. The elderly and those with underlying or congenital medical problems such as cardiovascular or heart disease, diabetes, chronic respiratory disease, and cancer are more likely to have serious consequences. As October 19, 2020, there were 4,000 million cases worldwide, while there were 4,900 cases in European Union and European Economic Association countries and the United Kingdom. The number of cases of deaths recorded by the European Centre for Disease Prevention and Control, which is an agency of European Union, is 200 and 1,000 deaths. So the COVID-19 is very dangerous disease that's spread around the world right now. So the European Union established the European Centre for Disease Prevention and Control, and we call it ECDC. I'm sorry, ICDC. I mean, in response to prevent the spread of COVID-19 outbreaks. The agency is tasked with providing official information related to COVID-19, both in terms of death reports, case occurring, as well as personal prevention forms that can be applied to either individuals, families, or groups. So the ICDC is a major of the responsibility is very huge. According to the official ACDC website, it classifies some of the following the things that the accessor of the ACDC website may know, especially EU member states. These include number 1, travel-related issues. Number 2, things related to children enrolled with school. Number 3, medical information. Number 4, prevention of COVID-19. Number 5, things about condition in the European Union are regular. And last, other things related to sport, postal package, food, animals, and cash when COVID-19. Okay, related to travel issues in the European Union during COVID-19 pandemic. In an effort to slow the introduction of COVID-19, many countries are imposing temporary restrictions on non-essential travel from third countries to EU territory by closing borders. Some countries have also implemented national border closures and or border checks at their national borders. or between different regions nationwide. These restrictions are subject to ongoing evaluation of epidemiological situation by countries and often change. So the risk of being infected on board cannot be excluded by but is currently considered low for individual travelers, taking into account the measures that have been put in place and the way ventilation operates in aircraft. The risk of being infected at the airport is similar to other places where many people gather. So the travel in AU is restricted when you are older and cannot prove the and cannot fulfill the requirement of the travel of the traveling requirement like PCR test and the other requirement from the country. And the next, school outbreaks have not a prominent feature, largely due to the fact that the majority of children do not develop symptoms when infected with the virus or develop a very mild form of the disease. No evidence was found to suggest that children were the main drivers of transmission of SARS-CoV-2 virus. However, studies have shown that children can become infected and spread the virus to adults when they are symptomless. And then, current evidence suggests that COVID-19 doesn't cause serious illness in children, not as much as it does in adults. However, they can be infected as easily as adults, although the extent to which children play a role in the transmission of the virus as a whole is still uncertain. Uh, when it comes to school closures, it depends on the decision of local authorities to temporarily close the schools and childcare centers. If the level of contagion in the community is so high that school maintenance becomes impractical, wherever school closure occur, it's important that parents and caregivers are supported, for example, by their employers allowing teleworking or limited office shift schedules so they can spend more time at home and take care of their children. The ECDC doesn't recommend school closures as an effective step to contain COVID-19 transmission in the country. So the school closure isn't the good recommendation. So it depends the local authorities for close the school or remain for opening the school. Okay, let's talk about the condition of AU countries or IAC and the United Kingdom. All countries in the European Union have responded to this situation through the implementation of a comprehensive package of measures, including surveillance, testing, increased hospital capacity, and isolation, contact tracking, and case management, and strategy to mitigate pandemic impacts, such as physical distancing measures. The ECDC is in constant contact with the European Commission and the World Health Organization regarding the assessment of this outbreak. So many countries have give such a effort to end this pandemic soon as possible. So the response option for COVID-19 based on ECDC program. Preparing for a widespread contagion scenario, some countries now seem to be progressing from limited local community transmission to continuous community transmission. This requires a strong response, focusing on containment and mitigation measures. Geographic areas that didn't experience widespread transmission during the first wave may have higher levels of population vulnerability and are less prepared for cope with increased demand for healthcare. Therefore, public health efforts should focus on strengthening the capacity of health service to manage potentially high COVID-19 patients. Here, recommendation or option for respond for COVID-19. First, the attention to key target population. So there is a three key target. The first, control transmission among older children and adults under the age of 50. The second, protect medically vulnerable individuals. The third, protect health workers, especially those involved in providing primary case. Primary care. So, the second, non-pharmaceutical intervention. Until a safe and effective vaccine against COVID-19 is available, the NPI will continue to serve as a major public health tool for controlling and managing the SARS-CoV-2 outbreak. However, some NPI can be negatively impact people's general well-being, so it must be under the control of local authorities. The third, testing strategies. Testing strategies have evolved during the epidemic and should now focus on broader testing in the community, prevention of nosocomial transmission, rapid identification of outbreak containment. Fourth, contact tracking. Quick identification, testing regardless of symptoms, and quarantine of high-risk contacts remain one of the most effective measures for reducing transmission. Number 5. Quarantine. 14-day quarantine is recommended for people who have been in contact with confirmed SARS-CoV-2 cases. This can be shortened in 10 days after exposure if the PCR test on the in the 10th day is negative. Number 6. Maintaining a strong message to promote compliance with health protocols. Risk communication message should emphasize that pandemics are far from over and that the SARS-CoV-2 virus continues to circulate in the community. The message like this is a marathon, not a sprint, and then we can't drop our guard. Community behavior continues to be the key to controlling pandemics. And the next, risk communication for young people or millennials. Communication campaigns that specifically target young people should ideally be based on insights gained through behavioral research to ensure that messages resonate with and are acceptable to the target population. So it's very about the message. And the next, protection of mental health. It is the last thing that should be responded while COVID-19 is still continue right now. Right, this video is made. So it's more to concern. People must concern about their mental health. So the government or local authorities too. In and the ICDC recommend to recommend to other SCDC, other AU states to protect their people mental health. So that is I gave you all about the COVID-19 and Europe. COVID-19 in Europe. So yeah, that's the point of this video. I hope you enjoy this video. Thank you for watching. Have a good day and stay safe.